In the United States and around the world, there's been a lot of attention focused on HIV, which is a disease which in the past, before antiviral therapy, had very high rates of mortality, almost 100% without treatment. What's happened in the United States and in Europe is that there's been a massive program to screen for HIV, and with treatment available, a lot of patients have been put on treatment and mortality has gone down dramatically. In the United States, 2 years ago, published in 2010, the Institute of Medicine developed a very extensive report on chronic hepatitis B and chronic hepatitis C in the United States and the need to take some action. And what they found was that 75% of patients with HIV are aware that they have the infection and only 25% are unaware. In contrast, with chronic hepatitis C, 75% of patients did not know that they had hepatitis C infection, and 65% of patients with chronic hepatitis B had no knowledge that they had hepatitis B infection, so these patients had not been screened. And recently, the Institute of Medicine report also showed that the mortality due to the combination of hepatitis C and hepatitis B has now exceeded that mortality from HIV. 15,000 patients a year are dying in the United States from a combination of either hepatitis B or hepatitis C. That's in contrast to 14,000 with HIV. That doesn't mean that hepatitis B and hepatitis C are worse diseases. In fact, most patients with these conditions will live through life without developing a complication. But what it means is that because there's such a large reservoir of patients with hepatitis B and hepatitis C who are not detected, unaware that they have infection, are asymptomatic, that these patients are presenting with decompensated liver disease and liver cancer and are dying of hepatitis B and hepatitis C complications. So what is being done in the United States? Well, the Institute of Medicine report had a profound effect. It was presented to Congress. It was presented to the President and also to the Department of Health and Human Service. And they were directed to develop a program in the United States to enhance the screening and management of patients with chronic hepatitis B and hepatitis C. And they have published online in the Health and Human Services website a 70-plus page document on what is planned to be done for chronic hepatitis B and chronic hepatitis C in the United States. Of course, this will depend upon funding, but because of the impact of this report, several agencies, including the Centers for Disease Control, have shifted money around from other programs and enhanced the hepatitis B budget, the viral hepatitis budget. The viral hepatitis division of the Centers for Disease Control is a part of the Center for HIV and Sexually Transmitted Disease and Tuberculosis. Of their total overall budget prior to this report, only 1% of the funding went to the Division of Viral Hepatitis, with more than 75% going to the HIV program. So what's happened is there's been money shifted around within the CDC to provide extra funds for the viral hepatitis division of the Centers for Disease Control. So last year, the CDC held a meeting of advisors, and one of my colleagues in Alaska, a nurse practitioner, Lisa Townsend, was a part of that advisory committee. And this committee came up with a recommendation that in order to enhance screening in the United States, that risk-targeted screening was not working. And since 5% of the population who are in the baby boomer ages, born between 1945 and 65, have been found by surveys to be hepatitis C positive, and 75% of the reservoir of persons with hepatitis C are located within that baby boomer age group. The CDC made a recommendation, and it was 2 weeks ago, it was officially endorsed and published in the Morbidity Mortality Weekly Reviews, that all patients who were born between 1945 and 1965 should be screened for hepatitis C antibody. Prior to that, the CDC had made a very strong recommendation about screening persons who were born in countries that were endemic for hepatitis B, be screened for hepatitis B surface antigen. and which is the marker for active infection. So, and these countries would include pretty much anywhere in Asia, anywhere in Africa, anywhere in the northern part of South America, the Caribbean, the South Pacific Islands included. So foreign-born persons need to be screened for hepatitis B if they come from any of these endemic areas. So in the United States, there's a push now, and it's really in its infancy, so we'll see how it works out over the next few years, to enhance screening for both hepatitis B and hepatitis C, and to identify those patients so that the percent of people who are going around without knowledge that they are infected will decrease from about 2/3 to 3/4 down to levels which are consistent with the percent of HIV positive persons who are aware of their disease. And at that point, we can try to get these patients into management programs and treat those who appropriately need treatment. So this is the goal. It's in its infancy. We'll see how it comes out in the next couple of years. There's a bill in Congress which has bipartisan support, but right now in the United States, no bills are going through Congress because of the presidential election. But hopefully, after the election, or maybe even after the first of the year, this bill will progress forward, and there'll be some money allotted to enhance this screening and management program that on paper has been pretty well planned out for the United States.